My name is Flordia Rue. I work at Jefferson Healthcare. I'm the Director of Surgical Services. I'm here to talk about colonoscopy. I recently had one done, and I just wanted to share my experience with you and to let you know how easy it is to go through the whole process, and more than that, how important it is for people to be aware that this is a procedure that we should all have done after we turn the age of 50.
We're starting our colonoscopy, and all we find is a little bit of bile, and that can easily be irrigated and aspirated away.
There are people that are afraid to have a colonoscopy, and it's fear of the unknown rather than the procedure itself.
We're going through the sigmoid colon now, which tends to be a little curvy.
And it's important to understand that when you're preparing for a colonoscopy, that you follow the instructions as written for the prep. And the reason for that is that when the doctor gets in there to do the colonoscopy, your colon needs to be, I call it spick and span, but it needs to be as clean as possible.
We're in the transverse colon now. You can tell by the little triangle-y shape of the markings in the colon here.
When the doctor is looking through your colon, they might find polyps, they might find diverticulum, which is little pockets in the intestine, they might find tumor, or the doctor may just see some redness and the doctor feels that he or she needs to take some biopsies.
And we're in the ascending colon, almost to the cecum. Okay, so we just got to the cecum. In the cecum, there's some landmarks that we look for. One is the appendiceal opening, the opening of the appendix, which is right there. Looks like a little crescent. So that tells us we're at the cecum. And then the other is the ileocecal valve, which is right here at the 3 o'clock position. That's where the small intestine empties into the colon.
Afterwards, you'll have an appointment with the doctor, and you'll go back in. If they took biopsies, if they took any type of tissue, the doctor will sit down with you and discuss the plan of action.
So now we're in the small intestine, and if you look closely, you can see little villi. And those little villi are the absorptive surface of the small intestine where a lot of the nutrients, vitamins, things like that are absorbed. And typically we're all on the lookout for polyps because sometimes they can be subtle.
And just because you have a polyp, you don't have to think that, oh my God, I now have cancer. A polyp can be a benign polyp, and most of them are.
So we usually take around 10 to 12 minutes coming out. We try to take at least a minimum amount of time to make sure that we're not missing anything here.
Well, we've completed the colonoscopy, and it was fairly standard, straightforward, and the patient did well. We did not find any pathology, things to remove. She did have some just minimal diverticulosis, which is very common, and right now she should be getting more and more awake and alert, and probably will be ready to get dressed and be on her way in the next 10 or 15 minutes.
All in all, my experience in having a colonoscopy was, I hate to say this, but it was great.